Welcome to this explainer. I want you to imagine, just for a second, that you're sitting in a doctor's office. You've just been handed a difficult diagnosis, or maybe you're thinking about joining a really complex clinical trial. The doctor hands you a 30-page document, densely packed with medical jargon and tiny text, and points to the dotted line. In that vulnerable moment, how much of that document do you actually understand? Today, we're putting ourselves in the shoes of that patient. We're going to break down the overwhelming world of the informed consent form, and we'll figure out exactly how we can transform it from a barrier into a bridge.
So it begs the question, right? How can you actually make an informed decision if the form itself is basically a foreign language? In healthcare, informed consent is too often treated as just a regulatory hurdle, a box to check off. But if the language is so complicated that a patient can't comprehend what they're signing, well then their consent isn't genuinely informed at all. It's a complete breakdown in transparency. Writing these forms so they're easy to understand without sacrificing the legal stuff is an absolute necessity. To tackle this, we're going to follow a really straightforward roadmap today. We'll look at why it's more than paperwork, balancing clarity and compliance, some plain language strategies, common mistakes to avoid, and finally, the future of consent. Let's jump right in. Starting with Section 1, more than just paperwork, we really need to shift our perspective on the informed consent form. We've got to stop looking at this form as a mere legal shield for an institution. It's not just a regulatory chore that has to happen before a procedure. An informed consent form, or ICF, is actually a vital communication tool. It is literally the main instrument we have for protecting a patient's autonomy. It exists to help participants truly wrap their heads around what they're agreeing to, putting the power of knowledge back in the patient's hands. Now, for this tool to actually work, it needs to hit a few non-negotiable points. It has to clearly spell out the study's purpose, what's going to be expected of the participant, the potential benefits, and the real risks, any alternative options, how their privacy is protected, and this is crucial, their absolute right to withdraw at any time without a penalty. When people genuinely understand these elements, it's empowering. They can confidently make health decisions instead of just blindly signing a scary stack of paper. Moving into Section 2, balancing clarity and compliance. This is really the core tension for regulatory writers. There is a massive tug-of-war happening here. On one side, you've got strict regulatory compliance. The law demands that these documents contain highly specific, rigid details. But if you just dump all that legal jargon onto a page, you end up with a giant, intimidating wall of text. On the flip side, you have everyday readability. This side is accessible, clear, and empathetic. You really have to balance the strict legal requirements with that human approach so the reader doesn't just completely glaze over. But here is the absolute key takeaway. The goal is not to dumb down the science. We aren't oversimplifying it, we are translating it. We're taking complex scientific and legal concepts and putting them into language that anyone can comfortably grasp, all while meticulously preserving the accuracy required by law. Remember, patients come from incredibly diverse backgrounds. A document that a doctor thinks is perfectly clear is usually totally overwhelming for the average person. All right, on to Section 3, strategies for plain language. Let's open up the writer's toolbox for clear communication with some concrete solutions. Check out this before and after. It's all about stripping away that intimidating medical jargon and replacing it with everyday alternatives. I mean, why say hypertension when high blood pressure works perfectly? Why use venous specimen when blood sample means the exact same thing to the average person just without the cognitive friction? If you absolutely have to use a technical term for compliance, the best move is to just explain it right there in plain English. And it's not just about word choice, it's about the entire architecture of the document. Information just flows so much better when it follows a logical sequence. You start with the purpose and procedures, ease into the risks and benefits, lay out the alternatives, and wrap up with privacy and contact info. It's intuitive. It guides the readers step by step instead of jerking them around between totally unrelated topics. Now, a huge part of plain language is also plain honesty, especially with risks. Patients deserve the truth without unnecessary alarm. Instead of being vague, you need to state the known risks clearly, explain how often they actually happen if you have that data, detail the safety nets you've put in place, and, this is a big one, admit what you just don't know yet. Being radically honest about uncertainty is exactly how you build trust. Which brings us to Section 4, common mistakes to avoid. Let's look at the pitfalls of even the most well-intentioned writers.
Even the pros can accidentally sabotage their own documents. There are some major red flags to dodge here. We're talking massive paragraphs of legalese, an alphabet soup of abbreviations, literally just copy-pasting text from the clinical protocol, overstating the benefits, or burying the critical stuff in dense blocks of text. If you're doing these things, you're just writing for the regulatory checklist, and you've completely forgotten about the actual human being trying to read it. But let me clear something up right now. Making a document patient-friendly does not mean lowering the bar on regulatory standards. Quite the opposite, actually. You absolutely still have to hit all those ethical elements, keep your terminology consistent, perfectly reflect the clinical protocol, and pass rigorous ethics reviews. A careful quality check ensures your document is both legally bulletproof and highly readable. You really can have both. Finally, Section 5, the future of consent, and how communication in healthcare is evolving. You see, the whole informed consent process starts way before a pen ever hits the paper, and our tools are evolving incredibly fast. As trials get more global, we're moving past just traditional paper forms. Now we're seeing digital consent platforms, interactive educational materials, and even video explainers, kind of like this one. These tools are dramatically boosting patient comprehension while effortlessly maintaining those strict regulatory standards. To wrap things up today, I want to leave you with this incredible point from our source material. Clear communication is no longer an added advantage. It is an essential part of ethical clinical research. Ultimately, informed consent is about respect. It's about giving people the exact knowledge they need to make choices about their own bodies and lives. So the next time you look at a medical document, I want you to ask yourself a provocative question. Are these consent forms truly empowering the patients, or are they just protecting the institution? Think about that for a bit. Thanks so much for joining me, and I'll catch you in the next explainer.